Hello dosto. Today we have come to another interesting episode of podcast. Can you guess the subject? The life behind the knife. Uh-huh. With us we are having a wonderful surgeon whose smile can only cure all your problems. Welcome to our show, Dr. Abantika Nath, the lady surgeon of Tripura. Welcome, Abantika, to our show.
Thank you.
Most welcome. We're so delighted to have you on our show. With this, we would love to know that people are so afraid about surgeries and all. How you have chosen surgical in medical field as your career? What inspired you to be a lady surgeon?
From the first year of my UG, that is the day I joined MBBS, I always loved dissection and I wanted to see the internal human body. That's the inner aspect of human body.
Wow.
As you can see, whatever there is inside. And so from the very first year itself, I wanted to be a surgeon. And
Wow.
after NEET PG, I got MS surgery, and so I opted
And
for
so
it.
this how will end up in being a lady surgeon. This is something, wow, we should really look up to. I remember in my school days, before my board exams, I had cancelled biology just because I was so afraid of blood. My God, hats off to you. So with this, I would like to ask a question on behalf of all the aspiring surgeons. Like, what are the preparatory steps to be a surgeon, or you can say those who want to prepare for NEET PG or something? Any tips you want to give to them?
First of all, the mindset. If a person is strong enough to deal with the blood, the complications going through intra-op and everything, that person can easily take it up. So, yeah.
Okay. Yeah, this mindset needs to be strong, and they like really has to be motivated that they can perform surgeries in
Yes.
near future. Like
And
this, yeah.
anytime emergency, there will be lots of blood, it will be dirty wounds and all, and that
Yeah.
person has to be strong enough to deal with all this.
Deal with all this. To ask you a question from your preparatory days of NEET PG, how many hours did you like contribute to studying for this?
Yeah, for that NEET PG, we almost study for 1 hour. Like after internship, I started my preparation, and so yeah.
Yeah,
Well,
1 year whole preparation,
Yeah.
and that times only books and everything. Where your friends,
Yeah.
I think no parties and all. हाँ, remember doctors बनना इतना easy नहीं है, ठीक है दोस्तों? Okay. So, how a day in your life, I should say, looks like? How a typical day in a surgeon's life looks like? Can you summarize it?
Yeah,
In
it's
time.
like
All-time
balancing.
hospital?
No, it's like hospital personal life is different. I personally have my own personal time. That's my cooking time. I have a pet. I have my family time different, and I have my hospital time. And I try not to mix it up.
Oh,
Like-
wow. So nice advice you have got, listeners. So I know you have a little pet,
Yeah.
your cute doggy. You like spending time with the...
Yes, I love to.
Yeah. That's great. That's great. So this could be some of your stress busters, na?
True that.
Yeah. Dogs have unconditional love to us, and yeah, they are like friends. With this, coming to an interesting part, I should say, like some myths and misconception you have ever heard from common people who like feel have said something to you, madam, this happens with us. Is it true or not? Anything you want to burst the common
Yeah.
myths around us?
The thing is that we often come across patients come to us and they seek for medical advice. So let's suppose a patient is coming to us with black foot,
Okay.
that's gangrene, and we'll tell that this patient needs some surgery. But then this patient will go to some quack doctors or something like that,
Okay.
and then they'll end up in havoc. Yeah.
Oh.
The second thing also, it happens in gallbladder stones also. Whenever we suggest for some surgical things and all, they'll go to quack doctors, they'll take their own medicines and all, and then they'll end up in just obstructive jaundice like things, maybe sometimes it even turns to cancer. So it happens. So whenever a surgeon is suggesting for surgery, I'll say, so don't delay it, don't go to any quack doctors, or don't do yourself home remedies and all, because there is no alternate for any surgery.
Okay.
So
okay.
they does it because they believe that they'll get cured.
because the patient needs to be cured as early as possible.
Yeah.
So that's why surgeon, whenever they suggest something, that's for the good or the benefit of the patient. Okay. So one more doubt that I heard in my childhood days, I would love to hear from you. Is it right or not regarding the myth? Suppose I have gotten acne or pimple. One of a distance cousin or something in my childhood has that Molly, just rub this up and squeeze it up, then the pimple will vanish. Does these things really should be done?
Actually, no, it shouldn't be, because if you just one example, just if you take it out, there will be some more infection. It will spread, and then it will leave you with a mark. So we shouldn't do that. Like we should always seek medical advices and all, and we should go as per the advice.
Okay, and with this, we can also come to a conclusion that touching our faces and this facial part with, or wounds even, I should say more appropriately, with dirty hands, and these things will also spread the infection much more. Yeah, we shouldn't do that, and these are some chota-mota precautions that we should follow. Because it's our habit now, always like touching our face and this part, nose part, and everything, our lips. So these are some common mistakes that we as a general public do much more. I too do very much. So as a general surgeon, what's your take on the today's lifestyle? What's your view? Is it like a good or bad? Anything you want to say? You have been seeing so many patients around us now. So what's your take?
As a surgeon, I must say people nowadays are really aware about a lot of things. They knows that the disease, they come to us with the diagnosis. Many people, they're educated enough. Okay. But then there are lots of people also who are unaware of the thing, and they really don't bother. So that's the difficulty we face, because when they're unaware of the fact, no matter how much we counsel, they won't understand.
So could you explain to our listeners what are the common bad lifestyle habits that you've seen, maybe in training days, internship days, or maybe your practice days, that lead people to some operating table? Like surgery was the ultimate option. You don't had any medication therapy or all.
Nowadays we are much more into fast food thing. So that causes lots of things. Like it can cause gallbladder stone. There is a very trend like parties and all. So regular chronic alcoholic patients land up into acute pancreatitis a lot of time.
Also alcoholic fatty liver and all.
Yeah, true. Yeah. Then their chronic smoking can lead to like something like Burgess disease. This is like, this happens that peripheral vessels of our lower limb, both the lower limb, it gets clotted. Okay. The blood circulation gets stopped over there. So if the person still doesn't stop smoking, then we have to cut the limbs.
My God, amputation is required, no?
Yes.
So this happens just by, people think just by using like tobacco and alcohol and like this type of thing. See, people just get alert. Okay,
lifestyle.
So for a healthy lifestyle, it's very essential to quit smoking, consumption of alcohol, and other all addictive substances, so that you don't end up in operation table, right? So what are the most common prevalent diseases that you would want our listeners to know, and most common in your practice you have seen, like very often cases you find it?
In Northeast, gallbladder stone is really very common because of the food habit.
Special cause you might have
obviously because of the food habit. Like it can be because of fatty female. A patient of about 40, then all these things. Fatty patient is taking up fatty meals often. So these things can end up in gallbladder stone. And Northeast is having huge gallbladder, like cholecystitis patients.
Patient. What are the common signs and symptoms people should look in oneself so that they could get a warning signal? Okay, this is the time to go to doctor.
Yeah, there will be pain in the upper abdomen, mostly in the right side, but not necessarily in the right side. And then it will go to the back and also tip of the right shoulder. Then patient will have some digestion
pain like excruting pain?
No, it is
or pricking pain?
In our language, it's dull aching pain. Like
dull pain.
The pain will persist. there will be pain throughout. Okay.
Throughout.
Then the thing is that there will be some digestion problem. The patient will complain, no matter what I eat, I am unable to digest it, and I have like bloated
gassy feeling all the time.
Sometimes it happens, it's nauseating also. Patient also comes with vomiting, and when the pain is severe, they come to hospital and we have to admit the patient and rule out what is the cause. So if it is acute cholecystitis, we have to go in that treatment and
treatment options that are available.
And the ultimate thing is he or she has to do surgery.
When is the right time to visit the doctor? Like when people would know that this is the time I should go to the doctor? Maybe just before. I wanted to ask this question because beforehand it gets very severe. When people should come to the doctor?
No, whenever someone is having any kind of pain in abdomen or digestion problem, he or she has to visit a doctor without taking own medications. Like there are some gas medicines which we call as PPI. These are over the counters also available.
Right.
So no need to take any
like Pentocid and all everything.
There is nothing to take OTCs. You better visit a doctor. If it is a simple gastritis, also will treat you accordingly. And if it is gallbladder stone, also will treat.
What are the diagnostic measures available for detection of gallbladder?
Whenever the patient comes with pain in abdomen, there are like symptoms. We sometimes we examine the patients and we can almost guess if it is cholecystitis or not. And second thing, we go for ultrasound of the abdomen.
USG of the abdomen. Okay. I have heard a few case studies regarding where the gallbladder stone was stuck in the bile duct. Is this an alarming condition?
This is a complication. If a patient is sitting long time with a gallbladder stone in the gallbladder, and these are small, tiny, because patient think that these are tiny calculus, so it won't harm. But so I want to aware, these are more dangerous because this will pass in the common bile duct. And this will cause obstruction. Yes. So that
lot of local inflammation over there.
That time patient will have some fever, some palpitations like thing, heartbeat will get raised up. That person will have a jaundice. So patient will end up in a very critical condition.
So they shouldn't delay the signs and symptoms their body is giving and must visit the doctor in right time to get the best out of medical service. With this, we would like to also know, like, what advice do you give to patients while you prep them up for any surgery?
We counsel the patient not to worry about the surgery, not to see any YouTube
we know surgeries are very frightening. Maybe it's just in our head. Maybe the thing is not that much complicated because we are in safe hands with good surgeons like her. So, but still we have a fear and apprehension. What if something goes wrong? Yes, I think there are chances, but you people handle it better. So can you just explain?
We counsel the patient about the complications, about the pros and cons of the surgery, but and then we try to come up the patients. And the thing is that nowadays anesthesia is also so much advanced. There's no patient cannot feel inch up anything. Like there is general anesthesia, there is spinal anesthesia, there are different types of blocks. Accordingly, the anesthetist will decide. So counseling is the main thing.
And also the family counseling,
family counseling and the patient's counseling. Well.
And so any post-recovery advice you want to give to patients who have suffered maybe some major surgeries or some minor surgeries, anything they can follow or change in their lifestyle to help them recover faster, maybe in terms of diet or something?
The patient has also to cooperate us. Like right after surgery, there will be pain. It's nothing like it will be painless or pain-free. During the surgery, the person won't feel the pain, but after surgery, whenever the person will have the senses back, there will be pain. So the person is also have to cooperate us, and there will be dietary changes as well. Right after surgery, we can't tell you to have some heavy fatty meal. It has to be like something healing type of meals and all. It should be protein rich, fiber rich, and patient should walk around. So we try to get back the patient to normal life as soon as possible, but the patient has to cooperate us.
people have an apprehension of getting up from bed or walking around just after surgery, but it's recommended by the medical experts to walk around and do something gentle movements so our body gets healed faster. Can you just give us some scientific basis for this?
Yeah.
Why it's needed?
So in our surgery, there is something called ERAS protocol where we have to early mobilize the patient.
Okay.
So there, after any kind of surgery, like you can see in gallbladder surgery, in appendix, even in cesarean section, we tell the patient after 6 hours, because up to that there will be some anesthetic effects.
Okay.
So we try to get up the patients after 10 to 12 hours and mobilize the patient so that patient will heal. Now the thing is that if the patient is still not listening to us and the patient is lying down, there are things that can get worse, like the patient will have some pleural effusion. Then
could you just explain a little bit?
It's like the diaphragm won't work properly.
Exchange of gases within
as
our
a result
lungs,
of which there will be some fluid deposition in the lung.
in the lungs. Yeah.
So there will be problem. And also if the person is not moving his or her leg, there will be some deep venous thrombosis, which is also very dangerous. So early mobilization
DVT, that is called.
Yeah, exactly.
That blood clogged in your veins.
So we have to early mobilize the patient so that the patient gets cured early.
Yeah, because blood circulation, proper blood circulation is very crucial for like our healing. So that
and nowadays this cholecystectomy is performed daycare surgery. Like the patient comes in the morning, OT is being done at night, they can leave the patient.
Wow.
Because so we prefer daycare.
Is it a minimal invasive surgery?
Yeah, exactly.
Okay.
So we prefer to leave the patient, let go the patient back to the normal life as soon as possible, because everyone is busy. So why to lay down on the bed?
Right, and also it reduces the chances of complication, I guess. How would you like minimally invasive surgeries are, as we can see now, that it has been more effective compared to the invasive surgeries in terms of patient's recovery, I should say. So are there any technological advancement in recent eras in your surgical field?
Yeah, laparoscopy is there now, robotic surgeries are there, they're cosmetically better, then it heals faster. The inside view is better. So yeah, laparoscopy is preferred over open nowadays, and obviously robotic surgery is the latest advancement in our field.
Right. With this, the word in my mind is AI. Artificial intelligence has gathered very recognition from all fields of work. I think it has done something innovative in your medical field also. So are there any AI-assisted surgeries like this, or are there any ongoing researches going on?
Yeah, robotic surgeries are mainly AI-based surgeries.
Okay.
So right now it's not available here at least. But obviously in metro cities people are doing robotic surgeries.
Wow. With this, I would like to ask, what are the lifestyle modifications a person, if follows diligently, may not end up in surgical table, or he may take care of his or her health in a better way?
So we shouldn't take normally we shouldn't take fast food so much. Like nowadays,
junk food, fried, oil,
egg roll and everything. So someone should take lots of water. Like intake of liquid should be huge. Like otherwise, there will be bowel movement is reduced, and there will be constipation and leading to fissure, fistula, all this thing. A good hygiene is very important. Then not getting addicted to any kind of smoking, alcohol,
substance abuse, like this sort of thing should be avoided. Yes. And also, do you recommend practicing few hours, or maybe whatever is the capacity of the individual, some basic gentle movements, or like anything, maybe as simple as going to gym or yoga, swimming, cycling, anything? Would you recommend this thing?
Yes. Nowadays people should do physical activity, should be there. Like it should be.
It's a mandate nowadays,
yes,
right?
because we normally have a sedentary lifestyle. We are very busy. We sit in a place and work. So there is hardly any body movement. Right. So there should be some physical activities, maybe walking, running, cycling, jogging, swimming, whatever.
Whatever is possible. Right? This will help them to like be healthy for a longer
Yes.
period of time. So as a general surgeon, you might have encountered many cases. So from your routine procedures to complex surgeries, and there might be moment where you might have felt something challenging has come up and you are not able to handle the situation. So what did you do at that moment?
Okay, so in the Bible of surgery, there is a term called bailout. Whenever
Okay,
we
means
suggest,
what this means?
okay, intraoperatively, like during surgery, if anytime I feel I cannot go through this, or I'm facing complication, I'm not able to do this, so
Okay.
I'll seek for help right that moment. I
Wow.
have to understand, so I can't waste any more time. I have to seek for help. It may be from my senior, my friend, my colleague, my junior, whosoever, but I have to seek for help right at that moment.
Right. So this is a wonderful lesson, dosto, कि whenever you feel you can't do it, there is no shame to seek help. Okay. So with this, we come to the final section of our podcast. Like, what the piece of advice you would give to listeners for maintaining the work-life balance, all the coping up with all the stressors in life. Everyone life has some or the other stresses.
True.
Now, this is inevitable. But what should the mindset behind it, and what you as a surgeon practice to like balance everything and still striving for the perfection?
No one should, like, everyone should keep their personal and professional life separate.
Okay.
Like those who are working in a corporate sector, they shouldn't get their corporate life, hectic life, their stressful life to home. Yeah, that shouldn't be done. Work is different and home is different.
Right,
So that's
right.
what I do. Like whenever I'm in hospital, I'm in hospital. I don't carry my personal life to hospital. Even if I am having a bad personal life, I don't carry it to hospital. I try to give my best to my patients, and if there is something even in hospital, I don't carry it back to my home and just spoil my personal life as well.
Right, right.
So I try to keep these things separate, and I'll suggest people also to keep both the things separate. And this personal time is mandatory, not like
Yes.
every time it should be work and
Work,
work.
work. All
So,
work and no play. Yeah.
Jack and
Jack
dull
and
boy,
dull
yeah.
boy. Right, right. So with this, thank you so much, Dr. Abantika, for giving us such an insightful tips behind the life, behind knife. Thank you so
Thank
much.
you. Thank you.